Hey guys, welcome back to my channel, The ENT Resident. Today I'll be starting a series where I'll be talking about septoplasty, and we'll divide the series into three parts. In part one, which is today, I'll be talking about what is septoplasty, what is the Goldman criteria in septoplasty, and what are indications and contraindications of septoplasty. Part two is going to be about the procedure itself, the surgical steps, and post-operative care. And part 3 is going to be about the complications of septoplasty. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. What is septoplasty? So, septoplasty is this conservative surgical procedure which is used to correct a deviated nasal septum by correction of only the deviated portions of the septal cartilage and or bone while preserving adequate septal support. Now, this is one of the common septal surgeries that we know of, and very commonly we are also asked about the other septal surgery, which is SMR, submucous resection of the septum. And what are the differences between septoplasty and SMR? SMR is more of a radical operation. In a separate video, I do discuss about the differences between SMR and septoplasty. You can check it out in the video. I've put the link above. But septoplasty in itself is the more conservative septal surgery that we know amongst the both of them. And here our main purpose is to correct the deviated septum by correcting only the deviated portion of the septal cartilage and or bone while we preserve adequate septal support. Now, the aim of septoplasty is to preserve as much of septal support as possible and resect only minimal portions of the septal cartilage and mobilize the septum to the midline. Here we take care so as not to remove most of the septal cartilage, because you'll see that in SMR ends up having way more complications as compared to septoplasty, because in SMR there's a radical excision of the septal cartilage instead of removing only the deviated parts. So, septoplasty, our aim here is to preserve the septal support as much as you can maintain and resect only the deviated portions and mobilize the septum to the midline. Now, next, let's try to understand what is the Goldman criteria for septoplasty. So, according to Goldman, septoplasty operation should fulfill the following criteria. First is it should be able to restore the function. So the function lost here is most of the time nasal breathing. So patient will come to you with nasal obstruction. The septoplasty operation should be able to restore the function. Second, it should prevent saddling. It should prevent drooping of the nasal tip. It should prevent retraction of the columella. Now, these are all complications that can happen in septoplasty as well as SMR, but more commonly seen in SMR because it is a radical surgery. So, these are all things you need to keep in mind, and septoplasty operation should be able to fulfill all these criteria. It should also prevent the flaccidity of the septum, and it should avoid the need of any free graft insertion for support, and it should lessen the vulnerability to any subsequent trauma. So, these are the 7 criteria that Goldman had suggested that a septoplasty operation should be able to follow at least these 7 criteria. So, that's about the Goldman criteria in septoplasty. Next, let's talk about the indications of septoplasty. Now, indications of septoplasty, whenever we are asked this question, we'll proceed in a very systematic manner. So, we will divide the indications into 2 types. We'll have septal causes and we'll have non-septal causes. So, first, let's discuss the septal causes of septoplasty. So, any patient who comes to you with a deviated nasal septum, you do not just perform surgery, because if you notice, about more than 50% of normal individuals will have a deviated septum, but they'll not have any symptoms. So, any patient with DNS is not an indication for septoplasty. What you need to look for is, does this patient present with any kind of symptom? Now, what are the possible symptoms that the patient will come to you with? So first of all, as you can predict, the number one indication would be a case of DNS who is coming to you with nasal obstruction on one or both sides. This will be a first indication for septoplasty. Second, a lot of the times you'll see a septal spur being present in the deviation. So, what is the septal spur doing? The most common thing that the septal spur does is that it, as you can see in this image over here, it will impinge on a turbinate or on the mucosa of the lateral wall. And what it will do is it will cause recurrent epistaxis because of this contact over here. And therefore, our second indication here will be a case of recurrent epistaxis because of a septal spur. Our third indication would be headache, which is caused because of the deviated nasal septum. Now, this headache can be multiple types. First can be, say, for instance, if the deviated nasal septum goes and blocks any of the ostium, like in the middle meatus, where most of the sinuses are draining, if it blocks the middle meatus, what it will cause is it will block the ostium, so it will impede with the drainage of the sinuses. That will lead to a headache in sinusitis. Next cause would be something known as Sludder's neuralgia. Now, what is Sludder's neuralgia? Sludder's neuralgia here is basically when a septal spur here, a septal spur which is impinging on the middle turbinate. What it does here is when the septal spur presses on the middle turbinate, it leads to pressure on a nerve. This is called the anterior ethmoidal nerve. So, Sludder's neuralgia is also known as anterior ethmoidal nerve syndrome. This is a neuralgic pain which occurs in the lower half of the face, and they'll also present to you with nasal congestion, rhinorrhea, and increased lacrimation. That's what Sludder's neuralgia is. So, Sludder's neuralgia can also be a cause of the headache over here. And the third cause is something which is known as the vacuum headache. Now, what is vacuum headache? Vacuum headache is when there is facial pain or headache because of negative pressure which develops inside the sinus. And this occurs because of the obstruction of the sinus ostium. Isn't this very similar to sinusitis? But what happens in sinusitis is there is an infection involved over here. But in vacuum headache, the headache is purely coming from the negative pressure inside the sinus because of the sinus ostium obstruction, but there is no infection happening over here. And this leads, because of this negative pressure that happens inside the sinus mucosa gets very stretched. So, this leads to a very dull, aching kind of pain, and that is known as vacuum headache. So, a third septal cause for indication of septoplasty is headache, which can be because of sinusitis, Sludder's neuralgia, or vacuum headache. And our fourth cause would be a patient who is presenting to you with sleep apnea or hypopnea syndrome. So, a deviated nasal septum, which is causing any four of these symptoms, will be your indication for performing septoplasty in the patient. You have to remember every patient coming to you with a deviated septum is not a case for septoplasty. You will only be doing if they are symptomatic with these symptoms. Now, there are not only septal causes to performing septoplasty, there can be some non septal causes as well. What do we mean by that? For example, number one would be, say, if we had to harvest a cartilage graft for any other surgery, for example, the common surgery that we do is usually a tympanoplasty, or say we are going to perform a septorhinoplasty or laryngotracheal reconstruction. In all of these cases, sometimes you may need cartilage as a graft. So here we can perform septoplasty to harvest the septal cartilage as a graft for these surgeries. So that is our first non-septal indication. Second would be when septoplasty is done as a part of septorhinoplasty. And third would be when we are doing this operation, the septoplasty, as an approach to improve the endoscopic access to other surgeries. What would some of these surgeries be? Sometimes what happens is a patient can have DNS and they do not have any symptoms. But say you're planning for some other surgery in this case. Now, because of the deviated septum, the endoscopic access inside within the nose becomes difficult. So, to improve the endoscopic access in certain surgeries, for example, we have the endoscopic dacryocysto-rhinostomy. Next, we have any surgery which we are doing to access the middle meatus and the frontal recess in endoscopic sinus surgery when the DNS is obstructing the view and access to these areas. Third, it can be because we are trying to approach the pituitary fossa to perform a endoscopic hypophysectomy. In that case, also sometimes doing septoplasty can improve the endoscopic access. And also in cases of Vidian neurectomy. So these are some non-septal indications for performing septoplasty. So again, if I had to recap the whole thing, our indications of septoplasty can be divided into septal causes and non-septal causes. Septal causes is when a DNS is coming to you with nasal obstruction, or there is recurrent epistaxis, or there is headache because of these causes, and there is sleep apnea. Non-septal causes would be one is to harvest the cartilage as a graft for other surgeries, to do it as a part of septorhinoplasty procedure, or the third one is to improve endoscopic access. It acts as an approach to other surgeries like endo-DCR or endoscopic sinus surgery or pituitary fossa or Vidian neurectomy. So these are all the indications of septoplasty. Lastly, before we end the class, we'll talk about what are some contraindications to septoplasty. So, any active infection in the nose and paranasal sinuses is a contraindication. You should first treat this condition before you perform any surgery. In that case, you'll actually get better results because of it. Even when there's active infection, you'll also have more chances of bleeding while you're performing surgery. So, this is definitely not an absolute contraindication, but it is preferable that you get the infection under control before you go ahead for surgery. Also, other contraindications, which are relative contraindications, these involved uncontrolled diabetes mellitus, hypertension, cardiac problems, uncontrolled bleeding diathesis. These are all conditions that you should first treat and get it under control before you perform septoplasty. So that's all for today. I hope you have understood it. If you have any further question, please note them down in the comment section and I'll get back to you. Thank you.